Diabetes is a common health condition that affects how our bodies use sugar, which is our main source of energy. It impacts millions of people around the world, from children to older adults, and can affect anyone regardless of age or background. So, when we eat, food is broken down into sugar or glucose that enters our bloodstream. Glucose is essential because it fuels everything we do, from thinking and moving to simply breathing. Our pancreas makes a hormone called insulin that acts like a key, letting this sugar into our cells for energy. Without insulin, or if insulin doesn't work properly, our cells can't get the energy they need to function well. In diabetes, this process just doesn't work properly. Either the body doesn't make enough insulin, or it can't use the insulin it does make as it should. Imagine having a door, which is our cells, and a key, insulin. But the key doesn't quite fit the lock. The door stays closed and the sugar remains outside. The sugar can't get inside the cells like it should, and it builds up in the bloodstream. Over time, this extra sugar can cause damage throughout the body. High blood sugar over time can lead to serious health problems affecting our heart, eyes, kidneys, and nerves. It can also increase the risk of infections and slow down healing. Understanding diabetes is the first step towards managing it and living a healthy life. With the right knowledge and support, people with diabetes can lead full, active lives. This guide provides a clear and straightforward explanation of diabetes, its types, symptoms, complications, and treatment options. It's designed to help you make informed decisions about your health. It aims to equip you with the knowledge to take charge of your health or support someone living with diabetes, empowering you to make positive changes and improve quality of life. To understand diabetes, we need to look at how our bodies normally control blood sugar. Two key hormones produced by the pancreas, insulin and glucagon, work together to keep blood sugar levels stable. Imagine them as two sides of a seesaw, working in opposite directions to maintain balance. Insulin acts like the brakes. When blood sugar rises after a meal, the pancreas releases insulin. Insulin allows sugar to enter cells, providing them with energy and lowering blood sugar levels. Glucagon, on the other hand, acts like the accelerator. When blood sugar levels drop too low, the pancreas releases glucagon. Glucagon signals the liver to release stored sugar into the bloodstream, raising blood sugar levels back to normal. In a healthy body, this delicate interplay between insulin and glucagon ensures that blood sugar levels stay within a narrow range, providing a constant energy supply to our cells. Diabetes is broadly categorized into two main types, type 1 and type 2. While both types involve problems with blood sugar control, they have different underlying causes and require different management approaches. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Without insulin, the body cannot process sugar effectively, leading to high blood sugar levels. Type 2 diabetes is characterized by insulin resistance, where the body's cells don't respond properly to insulin. The pancreas initially compensates by producing more insulin, but over time it loses the ability to keep up. This results in a buildup of sugar in the blood. Type 1 diabetes usually develops in childhood or adolescence, while type 2 diabetes is more common in adults, often linked to lifestyle factors like obesity, lack of physical activity, and unhealthy diet. High blood sugar, also known as hyperglycemia, is a hallmark of diabetes. Now, while some people may not experience any noticeable symptoms initially, others may develop a range of symptoms that can vary in severity. Increased thirst and frequent urination are common early signs. As sugar builds up in the bloodstream, it pulls water from the body's tissues, leading to dehydration and increased thirst. The kidneys work overtime to filter out the excess sugar, resulting in frequent urination. Unexplained weight loss, particularly in type 1 diabetes, can occur as the body starts breaking down muscle and fat for energy in the absence of insulin. Increased hunger, fatigue, and blurred vision are other common symptoms. If you experience any of these symptoms persistently, it's crucial to consult your doctor for a diabetes test. Early diagnosis and management are essential to prevent long-term complications. While high blood sugar itself can have long-term consequences, extremely high levels can lead to two life-threatening emergencies: diabetic ketoacidosis or DKA, and hyperosmolar hyperglycemic state or HHS. These conditions are medical emergencies that require urgent attention and can develop rapidly, especially if blood sugar is not managed properly. DKA is most commonly seen in people with type 1 diabetes, and it happens when the body cannot use glucose for energy due to a severe lack of insulin. As a result, the body starts breaking down fat for fuel, which leads to the production of ketones. Ketones are acidic byproducts that build up in the blood, causing a dangerous condition called acidosis. This can make the blood too acidic, which disrupts normal body functions and can quickly become life-threatening if not treated. Symptoms of DKA include nausea, vomiting, abdominal pain, fruity-smelling breath, rapid breathing, and confusion. In severe cases, DKA can even lead to unconsciousness or coma if not addressed quickly. HHS, on the other hand, typically affects people with type 2 diabetes and develops more gradually. It occurs when blood sugar levels rise to extremely high levels, often triggered by illness, infection, or dehydration. The high blood sugar in HHS draws water out of the body's cells, leading to severe dehydration and thickening of the blood. This can cause the body's organs to function poorly and increases the risk of complications. Symptoms of HHS include excessive thirst, dry mouth, confusion, blurred vision, and in severe cases even coma. Elderly patients are especially at risk, and symptoms may be mistaken for other illnesses. Both DKA and HHS are serious conditions that require immediate medical attention. Without prompt treatment, they can lead to severe complications or even death. Recognizing the warning signs such as sudden confusion, rapid breathing, severe dehydration, or fruity-smelling breath, and seeking prompt treatment can be life-saving for people with diabetes and their loved ones. If you or someone you know with diabetes experiences these symptoms, don't wait. Seek emergency care immediately to prevent serious complications and improve the chances of a full recovery. Diagnosing diabetes involves a simple blood test to measure your blood sugar levels accurately and efficiently. Several types of tests are used, each providing different and important information about your blood sugar control. First, there's the fasting blood sugar test, which measures blood sugar after an overnight fast of 8 to 10 hours, usually in the morning. Then, there's the random blood sugar test, which measures blood sugar at any time of day, regardless of when you last ate or drank. The oral glucose tolerance test, or OGTT, measures blood sugar levels before and 2 hours after drinking a sugary drink, helping to assess how your body processes glucose. And finally, the hemoglobin A1C or HbA1c test provides an average blood sugar level over the past 2 to 3 months, giving a broader picture of your control. Your doctor will interpret the test results based on established diagnostic criteria and your individual health situation. If you're diagnosed with diabetes, further tests may be recommended to determine the type and assess for any related complications or risks. While there's currently no cure for diabetes, it can be effectively managed to prevent complications and help people live long, healthy, and active lives. With the right approach, many individuals with diabetes are able to enjoy their favorite activities, spend quality time with loved ones, and pursue their goals without letting the condition hold them back. The main goal of diabetes management is to keep blood sugar levels within a healthy target range. This helps reduce the risk of both short-term and long-term complications, such as nerve damage, vision problems, and heart disease. Treatment for type 1 diabetes involves lifelong insulin therapy, which can be delivered through daily injections or an insulin pump. This replaces the insulin the body can no longer produce and is essential for survival. Regular blood sugar monitoring is crucial to adjust insulin doses as needed. Checking your levels several times a day helps you make informed decisions about food, activity, and medication. Type 2 diabetes management typically begins with lifestyle modifications, such as adopting a healthy, balanced diet, engaging in regular physical activity, and losing weight if needed. These changes can have a powerful impact on blood sugar control and overall well-being. If lifestyle changes alone aren't enough, medications may be prescribed to improve insulin sensitivity or increase insulin production. Your healthcare provider will work with you to find the best treatment plan for your needs. Regardless of the type of diabetes, long-term management focuses on maintaining healthy blood sugar control, managing blood pressure and cholesterol levels, and attending regular checkups to monitor for and prevent complications. Early detection and treatment of any issues can make a big difference in your health. Living with diabetes requires ongoing commitment and self-care, but with the right knowledge, support, and a dedicated healthcare team, you can live a full, active, and fulfilling life. Remember, you are not alone. Support is available every step of the way.